Major funding for Immortality Now was provided through an educational grant from Hotze Vitamins. Founded in 1993 by Dr. Stephen F. Hotze, Hotze Vitamins is committed to delivering only the finest quality vitamins and supplements to meet your patient's needs. Now offering customized vitamin packs, Hotze Vitamins is making it easier than ever for your patients to get well naturally. For more information, visit client.hotzevitamins.com.
This is Dr. Ron Klatz with another episode of Immortality Now, where we bring you the latest breakthrough science in the field of anti-aging medicine. My guest this evening is Dr. Eric Braverman. Dr. Braverman is a long-time supporter of the American Academy of Anti-Aging Medicine, a researcher of some note, a best-selling author, has one of the most impressive and well-known clinical practices in the field of anti-aging medicine in New York City, is an often quoted expert in the field of neurological aging. Dr. Braverman, welcome to the show.
Thank you so much.
So tell us now about your practice in New York City. What is it that you do there, and what makes your practice unique?
Our key thing in our practice is we do that brain-based, head-to-toe, computer physical. We believe that the computer can examine virtually every part of the human body piecemeal better. So we have memory scales that are done by computer, working memory, auditory memory, complex attention, verbal memory, processing speed, attention to omissions, commissions, reaction time, variable attention, different forms of processing speed, meaning brain speed called the B300. People think at 300 milliseconds, they're demented at 400 milliseconds, they got a tenth of a second to lose. Most people think at 300 milliseconds plus their age, so when they're 50, they're 350, when they're 40, they're 340, when they're 30, they're 330. So we can basically chart out dementia, we can chart out the Terry Schiavo case, where people are in coma. We could chart out people that are, brain dead. And so that war on Terry Schiavo, I predicted that she was brain dead. No one else kind of grasped that. So we have the ability to get brain processing speed. We know the parameters of early dementia, which virtually everyone starts to get by 50, and a lot of people have by 40, which is atrophy in the pituitary, frontal, temporal, parietal, occipital lobes. Usually when your voltage is down 40% and your brain speed is of a typical 40-year-old, you're already verkauft. So,
what kind of technologies are you employing in the clinical practice?
We use an ultrasound physical. We have which just means that we can go into the brain, get brain processing and voltage. We can go into the temporal lobes. We can go into a host of various areas of the brain. And we know that we have the ability to look at the carotids, and we get arterial plaque, and thyroid, we pick up the nodules, and the echo, we pick up the heart valve abnormalities. We also know we have the ability to help the liver. We know, pick up fatty liver early, gallstones, kidney stones, testicular nodules, growths, early ultrasound abnormalities of the breast. And we obviously have an MRI, but we have a 15 times more powerful MRI. We call it the living autopsy. You're stunned. As an athlete, I was stunned by my tears, people that come in with, chondromalacia, they just, first stages, they don't even know it with their knees. It's literally a living autopsy. We do every ankle joint section of the body. We do the brain. We do, circle of Willis. We see pieces of circle of Willis missing. We see pituitary atrophy. And we have neuroquant that shows the damage to the hippocampus. So it is unbelievable. And we have, between the PET scan and the 3T MRI and the in-house stuff, the brain mapping and memory and attention, we simply have a brain health checkup that's Star Trek all the way.
Are you actually seeing new areas of brain growth or repair or improvement in function or improvement in processing speed?
We're seeing brain processing speed improve 40 years. We're seeing documented memory reversals, and we've had some of our first hippocampal atrophy reversals.
What about hyperbaric oxygen? Are you using that, or CVAC?
The idea of hibernating brain tissue, I think the problem is aging is we burn up, we dry up, we swell up, and we calcify and, basically turn to stone. And then we're choked to death by our blood supply, and then we rust, and then we're an older caca. I think the big mechanisms there are not the hypooxygenation of brain tissue. It's the burn up or oxidation in general. So it's not low oxygen, it's oxidation in general. Then it's these other things like burn up, dry up, that the membrane brain integrity is destroyed,
Mm-hmm.
And then we burn up, dry up, swell up. I think the inflammatory processes where we basically, I look at dopamine as a flame, and then if you can't manage the flame, guess what we all do with age? Inflame. So I think you need to see what the word is. It really means that the fire of life is not being managed anymore by the hormones, diet, and the cells. I think we have to look at, in essence, that the inflammatory process is an aging process of mismanagement of the flame. And then we definitely have to look at sleep disorder and make sure, and calcification disorders. Basically, the whole frame leaches. And, basically you become an osteoporotic person. Calcium fills up in the brain. Calcium goes into our fingers. Calcium goes into our hands, our noses, our faces. It goes into our gallbladder, our arteries, our heart valves. So I think it's pretty obvious that individuals who do this need to start looking very, very seriously at. They can't become osteoporotic. You can't basically beat aging and become a shrinking old guy, a shrinking old bard.
Mm-hmm.
And so we have this ability to recognize you burn up, dry up, swell up, and turn to stone as the four cornerstones right there. So you have to keep the brain young, and then you got to deal with those four problems. And then you got to deal with the rust, which is toxins, pesticides, plastics. I had a guy in the other day, he had so much plastic in him that he actually, when he moved his bowels, a credit card came out. That's a lot of plastic. So that's the story.
Let's talk about age-associated memory dysfunction, because that's a concern, I think, number one concern of the baby boomers. What can someone in their 50s, 60s, just noticing that just things aren't right for themselves, what can they do? I mean, short of the whole enchilada,
Yeah, I think they got to know that, the brain controls the body, and they're only as young as their oldest part. And I think that, I think that's key for people. They really just have to know that the brain is number one in life. Mm-hmm. And if they don't know that, then there's a problem.
Are you optimistic about the new therapies that they're reporting on with regard to being able to dissolve neurofibrate tangles with ultrasound?
Not really. Once damage occurs in human bodies, it's really hard to get it back,
Mm-hmm. So these new anti-Alzheimer's drugs, you're not too impressed with the research on them?
All these drugs are 1 points. Look, let me tell you, let's make diabetes a sample model of what drug by themselves do. Let's say we take the person with a blood sugar of 414 or so, and we put them on the best medications, metformin, Bydureon. We might get 2 to 3 points down. If I change and put them on diet, and I put them on nutrients, and I put them on testosterone, like our old buddy, what was that guy, Ed, that used to speak, Lichtman?
Ed Lichtman, yes.
Yeah. Guess what happens? I get normalized hemoglobin A1C when I do a hormonal treatment, a drug treatment, a nutrient, and diet, and lifestyle and exercise. Nothing beats all four. Nothing, ever. So you got to do it all. No way around it.
Where do you tell someone to start if they're interested in beginning an anti-aging medicine program? Where do people go for the most reliable information?
They come to Path Medical. They go to Life Extension Magazine people. They go to Suzanne Summers people. They go to AFRAM websites. They go to the Brain Place, our place. We think, obviously, you and I have been doing this together for 25 years, basically, and we believe in what we do.
Well, it was good talking to you. I'm glad we had a chance to catch up a little bit, and good luck, and keep up the good work. Keep me posted in regards to your accomplishments.
All right, thanks, man.
Immortality Now is made possible in part by Hotzi Vitamins, now offering customized vitamin packs. For more information, visit client.hotzivitamins.com.